Hello guys, welcome to my channel. Today I'm going to talk about obsessive compulsive disorder, or what's commonly known as OCD. What is obsessive compulsive disorder? It is a mental disorder. Specifically, it is a type of anxiety disorder. Other types of anxiety disorders include generalized anxiety disorder, panic disorder, post-traumatic stress disorder, and social anxiety disorder. I'll talk about each of them in my future videos. So, obsessive compulsive disorder contains obsession and compulsion. People with OCD have either recurrent obsessive thoughts or repetitive compulsive behaviors, or they have both. They have to think about something or do something over and over again. Also, people with OCD are usually aware that their thoughts or actions are irrational, but they just cannot control them. Major types of OCD include checking, cleaning, symmetry and ordering, and intrusive thoughts. Like most mental disorders, causes of OCD is unknown. It may link to genetics and various types of life stressors. Other mental disorders like depression and anxiety also share connection with OCD. Symptoms of OCD usually start in adolescence or young adulthood. A common misunderstanding is that OCD means being really clean and organized, but it's actually more complicated than that. Here are the signs and symptoms for each type of OCD. First, a checking OCD is characterized by experiencing a fear of unsafety. People with checking OCD would always feel that their house is not safe, and to reduce anxiety, they would spend hours checking if the doors and windows are locked, if the ovens are off. They would also be constantly calling their loved ones to make sure they are safe. Another type of OCD is contamination OCD. It is defined by having an obsession of germs or contamination. People with this type of OCD would frequently wash their hands, change their clothes, and clean their house. They would try to avoid going to public places such as hospitals and restaurants. Symmetry and ordering OCD is believing that disorganization or imbalance will cause something bad to happen. To avoid bad things from happening, people with symmetry and ordering OCD would always make sure everything is placed in a specific order. They would experience discomfort or anxiety if something is off-center. Unlike the checking, cleaning, and arranging, one can also experience OCD internally by having intrusive thoughts. These are the bad thoughts such as punching someone or sexually harming someone. When these thoughts pop up, most people can just say, "Well, that was silly," and move on. But for people with this type of OCD, these involuntary and unwanted thoughts would just replay over and over again, which cause anxiety and fear of acting out these thoughts. To make a diagnosis of OCD, doctors would first order blood tests and physical exams to rule out physical causes of the medical condition. Then they would ask about the patient's feelings, thoughts, and habits. According to DSM-5, patients must present obsessions, compulsions, or both. Also, the thoughts or habits must be time-consuming. OCD can be treated with a combination of psychotherapy and certain medications. Cognitive behavior therapy, along with selective serotonin reuptake inhibitors, are proven to be effective. Thanks for watching. If you like my video, please subscribe. I'll see you next time.